Interprofessional learning has become a core part of the student experience within the program, and they understand the role of the team and different professions within that team. They have an idea of who they need to work with if they are treating a client, for example, who has many and complex needs, and they also understand their role within that team as well as the roles of everybody else.
If we think about where our profession is going in the future, what we're going to see more of is the need to work really effectively in interprofessional teams. When we look at what best healthcare looks like for a patient, it means a team around them of professionals who are communicating really effectively, understand each other's roles, and can work together well to ensure the patient's getting the best outcomes of their care.
In my early experience as a physiotherapists were always part of a team of people delivering healthcare, and the ones that worked well were ones where the patient was always at the centre of that team. These days we see that play out not just in large hospitals, but we see it even in private clinics. We see it in university programs where there's shared teaching and classrooms, tutes with a variety of allied health and other types of students.
One of the key components to our program has been embedding interprofessional learning across the years, and our students are given opportunities to meet and work with students from a range of other disciplines, including medicine, pharmacy, and across the allied health professions, occupational therapy, speech pathology, just to name a few. And that's so that they first understand what these professions do, how there is some interconnection and some overlap, as well as how they can best work with different professions to enhance patient care and patient outcomes.
It's really important that we prepare our graduates and all health professionals to be able to work really effectively in teams. We know that teamwork is so important for patient outcomes and for the best healthcare that we can deliver. Now, we need to make sure we're scaffolding this through our university programs, so students might get introduced to teamwork in their first year or really early on, and then we build on those skills over their learning journey so that when they graduate, they can work really effectively in teams.
In our clinic in South Australia, which is multidisciplinary, we've had a great opportunity to explore the team-based care of an individual. If we're connecting the right person to that patient, we keep the client in the centre of that decision making, it'll always be better for the outcomes of that patient. What it really comes down to is having a good respect for everybody's strength from their team, their profession. It makes it really easy then to determine who the best person is to connect with that patient and their particular needs. We've found that the key thing is communication. So as long as you've got all participants in the team-based care communicating with each other, we'll get a really great outcome for our patient.